Good day, and thank you for joining. I am Sherilyn Francis, and on behalf of the Morehouse School of Medicine Prevention Research Center, we welcome you to part 2 of our Family Meeting Virtual Series, FAM Strong 20. Additionally, we encourage you to find the Morehouse School of Medicine PRC on your favorite social media platform using the hashtag FamStrong20. The mission of the Morehouse School of Medicine, PRC, is to advance scientific knowledge in the field of prevention in African American and other minority communities, and to disseminate new information and strategies of prevention. The MSM PRC strongly holds to the applied definition of community-based research, which is dynamic, establishes community and research entity partnerships, is focused on prevention, is tailor-made, and emphasizes health policy to advance health equity. I will now present to you today's session entitled COVID-19, Dispelling the Myths and Media Literacy, presented by Dr. Dolapo Babalola and Mr. Russell Hobson. And now, Dr. Babalola.
Good afternoon, everyone. This is awesome. Thank you all for attending, and I appreciate the forum for inviting me as a guest speaker to this great session. I love the topic, dispelling COVID-19 myths. I mean, this is a fabulous topic. The reason why I like it is because, for me, I'm a strong believer that when you are well informed, you avoid misinformation. And when you don't have misinformation, then you have better outcomes. So my goal today is I'm going to highlight a few myths out there, the top 6 to 7 myths out there. And I'm going to use the data before us to just, go through this myth so that we're all on the same page. So COVID-19 cases and death are more prevalent among non-Hispanic Black population. That was one of the myths that started out back in February, early March, where we were told that COVID-19 is not a Black man disease, young people don't get it, don't worry about it, just go about your day. As we can see in the data before you that that's not correct. Unfortunately, not only do you have in a country where we have mostly whites, right? You have very few Blacks as well as Hispanic, but based on the cases that we see in the data, we had a lot of Black people that were infected, 38%. And on the flip side, how many did we lose in terms of African Americans? We lost quite a number. Now, I practice at Grady East Point, and the data for Grady East Point is right before you, about 186,000 thereabouts. And how many do we have in the ICU? About 88, with 8 patients under investigation. Of course, we're all full in the data, and we know how many we have in the United States. Next slide. Now, another myth, again, as I referred to, was the fact that the age range. We were told, well, the younger age range, they don't get COVID-19. As you can see in the data before you, that's not correct. The young adults, even though we do have a smaller amount in the white population, we have a disproportional amount in the Black population as well as Hispanic. So there is that disproportional that takes place, and it cuts across all the age range. Excellent. Now, this is a big myth that was out there in terms of chronic diseases. Unfortunately, when we compare Blacks to whites for chronic diseases, there is that increased risk for COVID-19. The reason why, if I take a pause here, is because COVID-19 is a virus, even though it's a common virus, but the COVID-19 is new to the community at large. Not only does it cause inflammation when it gets in through the mouth, through the eyes, and that's why there's all the guidelines, the CDC guidelines to avoid touching your place and washing your hands. When it gets in, it causes a cascade of inflammation. And with that going on, it further leads to chronic diseases, it leads to organ failure. In the presence of chronic disease, it just increases that risk of mortality and death. We see that in obesity. It's more likely that African Americans are stricken with obesity compared to 31% of whites. And the same thing goes on for hypertension, diabetes, and asthma. Now, according to the slides, there are a couple of myths that I want to highlight here. First and foremost, the first myth is high exposure fields. We see that a quarter of our essential workers really come from the African American population as well as Hispanic. And so it's so difficult to social distance. So when you hear a community, they say, well, I'm going to get sick wearing a mask. I'm going to be breathing in my own air and it's going to make me sick. That's not correct. Unfortunately, because of the community where, you know, we have time, especially in the Hispanic, you have a lot of people living together. So if one person falls ill, then everyone falls ill. So that happens. And again, we need to work, right? We need to provide food for our families. So we find that as I mentioned, one quarter of the marginalized population, they have to go to work because they make up the essential workers. So they're the forefront of the forefront. I alluded to the fact that the chronic illness is there in our population. Again, goes back to genetic predisposition. We also have food choices, which are not the best. So that puts us at risk. Higher uninsured rates. So I see patients at Great East Point, and that's in Fulton County. We find that 11% of Blacks are uninsured compared to 8% of whites in the US. And on the other end, poverty stricken. Unfortunately, 22% of Blacks have poverty issues, and that predisposes us again to this illness because they're far away from hospitals. When they get to hospitals, there's that implicit bias that takes place. So there are a myriad of things that just put us at risk and, you know, increase the risk of death among our population. So the few myths that I've referred to, let's track back. Black people, young adults, children are not affected. You can see through the data that was presented that that is not correct. That is a myth. We can see that Black people are affected, young adults, children are affected alike. CDC guidelines are not necessary. That is also a myth. Unfortunately, we can see, based on the fact that we are the ones that are more predisposed and prone to chronic disease, that we need to guard ourselves. We need to make sure that we're staying healthy, that we're building a strong immune system. We have to make sure that we're wearing our mask, because when we wear a mask, we're keeping our secretions to ourselves. And when we wear the additional layer of the face shield, it keeps any virus from attacking us. Now, the way it goes, unfortunately, because of the nature of the virus, you never really know who has it. So that's why you cannot be off guard. You always have to be on guard. You always have to wear your mask whenever you're in public area, just to make sure that you're safe. Another myth out there is retesting for COVID-19. I've had a lot of patients that have come in, tested positive for COVID, and unfortunately the workplace wants them to have 2 negative results. Based on the CDC guidelines, it's been noted that it takes about 12 weeks before a test can become negative. So retesting is just putting more pressure on our community. So I'm hoping that we have more education about this. And note here, if you go to a drive-through center, you have to be very careful. If it is positive, it's okay, but if it's negative, but you still have symptoms, you want to make sure that you go to the Georgia Public Health Center and go to a site or call your provider so that you get a proper test to confirm if you're negative or positive. One of the myths is I cannot share the virus if I do not have a fever. That is one of the strong myths out there that I'm hoping that we can get educated today. This is where we hear asymptomatic. Asymptomatic just means that you have the virus, but you're not symptomatic, meaning you don't have symptoms. It doesn't mean that you have to have a fever. I know that a lot of the centers are checking the fever, but it could be at different stages of the virus. It could be that it was a very early stage where you would not even pick up COVID. It could be the second stage where it becomes positive, or an early stage of the illness where you begin to show symptoms, or this advanced stages where you have patients having shortness of breath and they're just fatigued and very weak and they're in the hospital. So note here that it is definitely a strong myth out there that you need to have a fever for you to be ill or for you to have COVID. You can very well have asymptomatic presentation, and you need to be aware of that. And that's why we're advised to wear our mask at all times and to wash our hands. Healthy lifestyle is not helpful. Now, this is definitely something in our community that we have to advocate for ourselves. We need to be strong with our immune system. We need to eat healthy. We need to make sure that we're keeping our immune system strong to combat any virus. So even if it's not COVID-19, we have to make good food choices. And I know that in some communities, it could be, limitations based on what is available. So we need to, be aware of the resources that are available to us. Make sure that if you haven't had a follow-up appointment in a while, call your doctor. If you're on medications, take your medicine, because you want to make sure your chronic diseases, diabetes, hypertension, all of that is well controlled so that you don't have a cascade of things in case you come in contact with COVID-19. Medications needed for treatment are not available. Well, there's been a lot of controversy here about, lately in the media, hydrochloroquine. Is that for treatment? Is it not? There's been lots of studies that have shown it's not conclusive. Now, in the early part, I do have family members that were treated and were fine. But because of the controversy around it, because of the complications that arise around it, that's why they've kept that on the down low for now. There are other medications. If it is an early, if you're just having some cough, we can treat that symptomatically. So whatever symptoms you have, if it's fever, if it is a cold, building your immune system, there are treatments. If they're in the hospital, trust your doctors to take care of you. At Grady, they're doing a fantastic job there. And last but not the least, myth that I would like to discuss today is vaccine is not the solution. Again, I do agree to a certain extent that it isn't, because if we keep ourselves strong, and healthy, making sure that we eat the right foods, that we're exercising, we're building that strong immune system, it's going to combat any virus. Now, for the vaccine, it takes a series of trials. And so I don't believe it's the only answer, but at the same time, I don't want us to belabor ourselves on vaccine. When is it going to come out? If we just ensure that we follow those guidelines, the CDC guidelines, and we live healthy and strong, and then we'll keep our bodies ready for anything that comes its way. So far, these are the myths that I have. I'm definitely open to question and answer towards the end.
Thank you, Dr. Babalola, for sharing those extremely important facts and dispelling very specific and prevalent COVID-19 myths. And now we will transition to Mr. Russell Hobson, who will discuss how we as members of communities can make sure that we are leading and adhering to CDC guidelines and recommendations around COVID-19 prevention, in addition to discussing strategies that we can employ in order to avoid or to discount COVID-19 misinformation.
So good afternoon, everybody. Can everybody hear me okay? Just say yes, no, maybe.
Absolutely.
All right, great. It's always an honor to interface with folks with the Morehouse School of Medicine Prevention Research Center. And it's always funny when I have to speak alongside a trained medical professional, just as a healthy human. But I do have a large amount of connectivity with my community, and I see a lot of the stuff, a lot of the habits that I think are leading to the disconnect in our communities, as well as the heightened rate of infection sometimes. I'll speak more in terms of current events. There's been a lot of publicity recently in Atlanta for different social upheaval, and upheaval that's necessary. However, we cannot fight one war and lose another one at the same time, right? So as we continue to try to work on behalf of social justice, for instance, the Wendy's where Mr. Brooks was murdered is around the corner from my house. So the first day that they were having protest out there, I went out there with a box of these because my company gave us surgical masks, and I just wanted to hand out surgical masks to people just to say, hey, listen, just because you're out here doesn't mean that we have to take the disease home to our family or whatever, what have you. And that's what we see a lot of now as we get to a point where we've been sequestered in quarantine for a long time. People are getting to a point where they just want to feel free. They just want to get out of the house. They just want to feel some level of normalcy. And when that happens, we start to make these deals with ourselves about our health and wellness, because we're willing to roll the dice, so to speak, just in an effort to kind of return to some sense of normalcy. And a lot of us have lost people in this pandemic, but some of us who haven't, even though there's death all around us, we haven't really come to terms with the fact that this could easily have been managed and put away like it was in other countries if, from the top down, we took measures and we all adhered to measures that would keep us safe consistently. If it's not staying at home, then it's at least saving or trying to protect the more vulnerable populations, which really honestly aligns more closely with people like us, people of color, people in our communities who we are advocating for. So what does that entail? As I said, this should be standard operating procedure right now. People always, you see people, and I brought all kinds of little graphics. Like, anybody see these, the little face shields? These are great, but they're not easy to come by, right? So, some people rock the little face shields, which is cool because it does allow you to breathe a little more freely and allows you to see. These are probably the cheapest option that are the most readily available. They're selling these at every drugstore now. They're a little inflated in price, but honestly, you can normally get these for pennies a piece. And this is just a surgical mask. And I'm sorry if I'm being redundant, but let's go with the easy way. So you put it on, you pin it up here at the top of your nose because it has a little hard wire at the top. And then if you even want to make it a little more secure, you can flip it so that you kind of have a little bit more of a pocket, but it also cups your face a little bit more. Whenever you go around other people, leave the house, you should be wearing a mask. Another option that people are doing now are the cloth masks, which are a little more stylish. I don't have one of the ones with all the crazy patterns on it, but they kind of have the elastic. They fit, they cup your face really nicely. They look cool, right? I look like a ninja or something. These are not quite as safe as the surgical masks, but you can get ones that have linings on the inside, which make it a little safer. But the bottom line is, why are we wearing a mask in the first place? People often say things like, I don't have to wear a mask because I'm healthy. And that is, to me, the embodiment of hubris and narcissism, because we don't wear a mask to protect ourselves. We wear a mask to protect other people. Even if you think you are healthy, that just means that you are a more apt carrier for the disease to spread to unhealthy people, because your healthy butt can walk around and not even feel it while you're infecting all of the at-risk people who you come in contact with on a daily basis. So Adrian said, are filters needed for the mask? It would be preferred to have filters, and they do provide filters. A surgical mask has a natural amount of filtering because it's made with like a dual layer thing. For fabric mask, if you can find filters, those are preferred. We're just trying to do the best we can to limit exposure and what was it called, like infecting other people while still living our lives normally. We're at a point now where we have to live our lives as normally as possible. Oh yeah, here's the other thing. I don't wear glasses, but I love wearing fake glasses, because one of the easiest ways that COVID can also be transmitted is through your eyes. So wearing something like your cool little Warby Parker frames, or like some cute little frames that you got at Walgreens, could actually, in addition to a mask, reduce your probability of getting infected. So so also keep in mind that I am a health nut, right? So one of the things that they did originally was close all the gyms, and I am a huge gym person. So now what the gyms have done and reopened is you have to wear a mask to go in, but it's still a closed, confined space. Whenever we're going into closed, confined spaces, even if we're 6 feet away from each other, keep in mind that most of the air in those places is being recycled, it's being moved around. We are not exactly aware of all of the ways in which COVID-19 is transmitted, but we are aware that if the particles, if aspirated from somebody's mouth, could float around in the air and be active, which means that when we are in closed spaces, we have to protect ourselves as much as possible. So when I'm in the gym every day, I'm wearing masks, and I'm normally wearing eye protection or like a hat pulled way down over my eyes. And we have to kind of do what we have to do to minimize our risk while still living our lives as best as possible. And because of the fact that, like, for instance, my mother's 75th birthday was this past weekend, I went and got tested the week before and then limited my activity the week so that I could reduce any risk I could potentially put on her when I went to see her, because she lives out of state and she lives in a confined space in assisted living. We have to be more conscientious for other people, even if we're not particularly conscientious for ourselves. And whenever I talk to people who say things about how good they feel and how they don't feel like they're a risk, it has nothing to do with you. You know, protecting other people is our highest responsibility right now during this time. And that's what I try to impart upon people as much as possible. And you are right, Dr. Akintobi, it is hard to work out with that mask. Sometimes when this thing gets wet, it feels like waterboarding. Like when you're trying to breathe through a wet mask, I have to like walk away or pull it away from my face a little bit. But what are the alternatives? We have to understand that for a while, our new normal will be doing the things that we standardly do just a little bit differently, with more thought and more precaution put into it. So other misconceptions that we commonly hear, I mean, I think Dr. Babalola spoke to a lot of them on the front end. I think of the things that I see most frequently as far as misconceptions is the fact that this particular disease has nothing to do with politics. Whatever your belief system is, ideologically, politically, it doesn't matter. Another thing that's interesting is that a mask is not some affront to your civil liberties. That's a huge misconception. Wearing a mask is not about freedom. It's about love for your common man. And if you don't have love for your common man, then you shouldn't be out in public potentially risking them. You should just take the singular responsibility of limiting the amount of exposure you have and the amount that you can expose other people consistently. So when I'm out talking to youth in the community, we recently did a deal where we had to repaint the walls of Carver Market because it was vandalized. And when we were out there, everybody had a mask. There were a lot of young folks out there, and I was like, hey, put on your mask. Hey, listen, it's okay. Not down off of your nose, but keep it all the way across the bridge of your nose. Do everything you can to maintain a seal, so to speak. Other than that, I think everything else can kind of be more question-based. Like I said, as a community member, I just try to impart as much knowledge as I can to those around me as regularly as possible. Also, I think through my social media, I say a lot. And one thing I say is like, you should not be shamed for trying to be safe. I've been to a few gatherings where I'm the only one wearing a mask, and they're like, hey, why are you wearing a mask? And I'm like, what I say to try to be gracious is like, I'm trying to protect you. It's not about you all. I just don't know where I've been. And since you don't know where I've been, how about I just wear this mask to make sure that you guys are safe? Whenever you do that, people have a hard time trying to shame you because you make them realize that they are not trying to protect the people they care about. Other than that, I think I'll leave the rest for questions. But thank you for letting me speak and letting me talk about some of the simple things that I try to do on a daily basis.
Thank you, Mr. Hobson. So we actually do have a bit of a lively discussion and some questions from the chat pod, and we will come back to this slide towards the end, so we will wrap up. One of our first questions comes from Brenda W. And Dr. Babalola, Brenda W. would like to know, can you please, can you go over the third misconception again regarding testing?
Absolutely, I'm happy to do so. Now, this came up from the CDC guidelines. I've had several patients, as I mentioned, have tested positive, and they expect outside of the 10 to 14 days being quarantined that they would have automatically 10, 14 days, it now becomes negative. And again, most of our community, they have to go back to work because the employers rather want a negative. It's not going to happen because it takes about 12 weeks before you get a negative. Based on the CDC guidelines is what I'm referencing here. Some of them have had to have repetitive 3 tests, and you know how long it takes to even find a site and then to get the results. So it's causing a lot of problems. If we educate ourselves, our employers follow those CDC as well as the WHO guidelines, we are certain that as long as they've maintained the quarantine status, and that's the tricky part. People tell you they've quarantined, but you don't know. So I can understand it's a legal issue that before you let people back into their workspace, that they need to have a negative. But if we can just believe that they said, okay, they kept themselves quarantined in a place 10, 14 days, and they haven't gone all over the place to reinfect themselves, then it's safe enough to say they can go back. They don't have symptoms, it's safe really. So that's the guidelines that we're following, that it takes about 12 weeks. And that's just because it's called a dead virus. So after that 14 days, you're outside of that 3 stages of virus disease that I referred to. It's now dead, it's encapsulated, and it's not shedding any more of the virus. So you're not symptomatic enough to shed anything. So even though it's positive, you're not infectious at that point.
Thank you so much, Dr. Babalola. Our next question, and this could be open to you and Mr. Hobson. Can you please provide us with some tips and guidelines around how we can ensure that the COVID-19 information that we are viewing, consuming, and sharing with our friends and family are credible and are appropriate to share?
I'll jump in on this. Let's just go ahead and assume that everything you see on social media is fake or not. You could just go ahead and assume that. Like, if it's not coming from a viable news source, which means, let's just say the ones that we know: Atlanta Journal-Constitution, the CDC, National Institute of Health, maybe the New York Times, the Washington Post, CNN. I'd even be a little questionable of Fox News or MSNBC. We just have to make sure that if we hear something, we vet it properly. It is easy for news to come directly to us and therefore be good news. Because it's coming right to us, but that doesn't make it accurate whatsoever. If there's money involved, which is kind of the case on social media, there is an enormous potential for there to be some other motive in what you're seeing, because they only send stuff to you based on what they think will profit from you or what they think is something you want to hear versus might be informative. So what I try to do consistently is look on, I'm kind of lame. I go to like BBC. I try to go to news sources outside of the United States sometimes. I definitely still check the Atlanta Journal-Constitution for local stuff, and I go to the New York Times. But as a normal human, a lot of us aren't really looking at the printed word like that anymore. I just would strongly say, if somebody says, I heard is not viable. You have to verify. You have to verify something, and not by another person, but by a place that would get in trouble if they reported something wrong. Sorry to speak so emphatically.
Thank you. Oh, no. Thank you very much. Okay, so we have our next question from Miss Mary G. So Miss Mary G would like to know, how can we get the testing stats for our community, and that may be more on a county level?
Well,
so I believe those would be testing stats, possibly in the number of tests given, positive cases, and stats around that.
Right, and then that would be fabulous to have that adequate data. As we're aware, the early part of the disease, we realized that we were not getting all the data provided, but things have since improved. So the most accurate really would be from the CDC website as well as the Georgia Public Health, because they have several counties that are issuing the test. So that would be, those 2 resources would be the best way to get the most accurate data. Now, expect that it's going to be a plus or minus, so it's just going to be an average, but we still are not going to be able to get the direct information, because you have a lot of people that right now it's still taking a long time to get the results back, and some people stay in line and they've waited for 3 days and not even gotten tested. Doesn't mean that they're not positive. So let's just measure that and have a mind frame that whatever numbers we're seeing is really inflated. But those are the 2 sites that I know will give you the most accurate information.
Thank you so much, Dr. Babalola. And Ms. Mary G., there is a link, a website here to the CDC's page where they provide actually state and county level stats on COVID-19 testing cases, hospitalizations, and I believe deaths. So this is a wonderful source for that information. So moving along, Mr. Richard G., and this is open to you, both Dr. Babalola and Mr. Hobson. Mr. Richard G. notes that there has been a physician on television promoting hydrochloroquine. And actually, this question is for you, Dr. Babalola. He would like to know, are you prescribing and recommending this treatment?
Well, I figured this question will come up, and I did mention it briefly as one of the myths out there. I'm very much aware of the medication hydrochloroquine. Now, I am originally from Nigeria. That's a country where malaria, and I have, while I was in Nigeria, went to medical school in Nigeria. I took the medication because I had malaria. So it's not an uncommon medication there in, West Africa, third world country. We use it, but it's under supervision. Now, when COVID struck the US, like I mentioned, I had a few friends that were treated. They were intubated, and they were going back and forth between hydrochloroquine and other medications, testing it back and forth. Some have, if not that I had a personal experience, she got better with that after 11 days. There are a few that I know that initially when the doctors were comfortable in the ER, in the ICU. Now, I do mostly ambulatory care. So I haven't placed any patient on the medication. When patients come and we screen them, we do the test. Most of them are mild. They just have to just do the, 10 to 14 days quarantine period. It has been shown in the early part of it. I know a lot of doctors are advocating for prophylaxis. Even our president said he's taking it as a prophylaxis. Just because we don't have conclusive data, it's just a controversial thing for doctors right now as it stands to administer it. Now, I'm not saying that in the third world country they're not, because if they can't afford high expensive medications, that's what they're going to use. But the point here is it needs to be under supervision. If your provider is not comfortable prescribing it, you can't get it as a prescription, because then you're not being monitored. You could have all the side effects that come along with it, whether it's arrhythmia. Everybody's situation is different. Like Mr. Hobson said, you don't just believe everything people tell you, because you don't know their unique situation. So the medication has been preached to be useful. I will caution at this point that you stay away from that. Ask your own primary care provider. If it's said that we're not supposed to use it, then let's go by that. And instead, make sure that we stay healthy, we eat properly. If we do all of that, we wear a mask, then there won't be the controversy back and forth that, well, do I need to use this medication? Which medication is safe to use? I hope I've been able to answer the question so far, but I have not prescribed it for anyone. I have not seen the need to do so.
Okay, wonderful. Thank you. So our next question, one question is from Ms. Adrienne P. and the other is from Ms. Cassandra D. The questions are about, again, using protective wear. So Ms. Adrienne would like to know what type of fabric is ideal for a cloth mask. And Ms. Cassandra would like to know, what are your thoughts about wearing gloves in public spaces, understanding that some surfaces may be contaminated?
I don't have any knowledge about the mask piece. I've seen lots of different data on it. I think for the most part, the more layers the mask, the better. And keep in mind that all a mask is doing is preventing the particles from flying directly into your mouth. If it blocks all particles whatsoever, then you can't breathe, obviously. So it has to just be dense enough. But Dr. Babalola, do you have a better understanding of that?
Well, to your point, I agree. You answered perfectly there. You want to make sure the layers. So it has to do with the layers. Of course, the physicians in the ICU, intensive care, the N95 is what will, keep them from getting the virus. In the early stages, we had different, experiments on the different levels of mask protection. The message here is the more layers, better. But even if it's just a surgical mask or it's just a cloth, as long as you keep everything sealed and it's properly worn. I don't think the argument should be which one, as long as you have the coverage. You want to make sure that the way you take it off is also very important, because that is not something I hear a lot of, education about. You see that when you come, like when I'm in the clinic, not only do I have my N95, but I have another cloth over it. And the reason is because if the virus does come in contact, I don't want to have my N95 infected with the virus, right? So we always recommend you take it off from the ears and then you put it in a plastic container, a bag, because you don't want to take it inside the house. And my kids, I always have to remind them when we go out, keep it, in the car, keep it in a plastic bag. Because imagine you do all that work and then you take it off the wrong way and your hand gets in touch with the virus on the mask. So you have to not only cover it, but make sure that you're taking it off the right way. As for the gloves, now I don't wear gloves outside, and this is a personal preference, just because when you wear the gloves, what if you touch your eyes? It's infected. We're so used, we're creatures of habits, and I am. So I will touch, randomly. But if I just pay more attention to washing my hands, using my hand sanitizer, I think I'm actually safer that way, because when you wear gloves, I've heard and I've seen where you wear gloves and people you're not able to wash your hands where you wear gloves. So really just washing your hands constantly is a better best practice for me. Some people wear gloves. If you feel comfortable wearing gloves, that's fine, but just make sure that you're taking it off the right way. And if you touch surfaces, that you have to keep changing those gloves. So it's a lot of multiple steps that you have to do when you wear gloves. I don't know if Mr. Hobson has anything about the hand gloves.
Yeah, I mean, with gloves, just like with masks, you should operate under the assumption that the outside of it has whatever you're not trying to touch on it, right? Mm-hmm. So the analogy I use, which is kind of crude, is imagine you got some dog feces on the outside of your mask or on the outside of your glove. When you're taking it off, you're not taking it off like this. You are being so careful not to actually touch the outer surface of those things, because of the fact that that's exactly the contaminant you're trying to avoid. People get a false sense of security when wearing gloves because they're like, oh, well, I got out of gloves, I'm good. I can touch whatever. Think about this too. The people who prepare your food, like whenever, I don't really eat fast food too often, but whenever I go to a restaurant and people are using my gloves to handle money or anything like that, yeah, they're safe, but their gloves have touched the person before you. So we have to really start changing our daily habits, primarily with regards to hand washing, regardless of wearing your gloves or not, and how often or how infrequently we can touch our face, mouth, and eyes, just in general. I pretty much, as a standard, don't touch my face, mouth, or eyes unless I can remember the last time I washed my hands. like I'll be like, oh, well, I guess I'm just gonna have to wait for this itch because I didn't wash my hands for a little while. And hopefully that, that'll be a little bit better. It's just small little changes in our behaviors that can really make big differences.
Thank you so much, Mr. Hobson and Dr. Babalola. We have actually run over time, as you tend to do when you are having a good discussion with your family. Sometimes you may have asked for 30 minutes, but sometimes you need a little bit more. So this was a worthwhile and well-discussed family meeting. So thank you both. So Miss Mary G, so I want to point out, Miss Mary G says that she just wants to live. And I agree with Miss Mary G. I just want to live too. So Dr. Babalola and Mr. Hobson, I ask every presenter for their charge for us as a community and us as a family moving forward. So what is your charge for us moving forward so that we can just live and thrive? What is your charge for us?
Thank you. Thank you for that. Just live. That's amazing. That is the goal for all of us. And I do applaud you all for coming out and attending, because it looks like you want to get all the knowledge that you can to live. So my charge for you and for myself, that in our community, we already know what our risk factors are. We already know what the numbers say. What is our responsibility? How are we going to change the narrative? What are we going to be responsible for? I say prevention is better than cure. I would rather prevent it than struggling to treat it. So how can you prevent it? building a strong immune system, eating healthy as much as possible, you know, family, individually, exercising, no matter how little it is, even if it's just 5-10 minutes walk, it makes a difference. We need to build a strong immune system so that it's ready to wage war against any disease that confronts us. Thank you.
Stop stealing my words, doctor. So yeah, I think that this pandemic has exposed the previous and underlying pandemic, which is that we, as people of color and in certain communities, have not been doing the utmost and most practical job of taking care of ourselves. Underlying conditions are exacerbated by COVID-19, and that is why we have been hit harder. Anybody who knows me well, matter of fact, I worried the people on this call because I was out running and barely made it to the call in time. And they were trying to be gracious and nice, but I know they were like, is Russell gonna make it in time? Because he's just getting back from a run. And so what we have to do is make sure that we are using this time that we're spending in our houses could be the time in which we're trying to learn how to eat better, in which the time in which we're applying pressure to those around us who we know aren't having good habits to create better habits with regards to their diet and exercise, maybe doing it with them. We don't know what the next pandemic will be. We don't know what might be around the corner. We don't know if this particular pandemic will take a positive or negative turn. All that we can really be in control of is our own personal health and wellness and the things that we do to make sure that we are better. A lot of people put on 19 pounds for COVID-19. I'd like to see people lose 19 pounds for COVID-19. Let's lose 19. It makes us better, more viable humans, helps us to help the people around us. And let's just try to be as healthy as possible. If anybody needs me specifically, I'll gladly go out and run with you. I'll gladly talk to you about some things that I do because I believe in this lifestyle. And thank you for just letting me talk to everyone.
Thank you. Well, thank you, Dr. Babalola, and thank you, Mr. Hobson, for an extremely engaging and informative presentation. We truly appreciate your time. And to all of the attendees, thank you for spending your Saturday evening with us. So we know that you love us because you are here, and please know that we love you because we are here also. And on behalf of the Morehouse School of Medicine Prevention Research Center, we ask that you find us on your favorite social media platform. Again, you can simply search the Morehouse School of Medicine, PRC, or you can search MSM_PRC. But be certain to use the hashtag FAMStrong20. And that concludes today's event.